Welcome to the Situation Report for the Thunder Bay Regional Health Sciences Center. I'm Heather Vita, the Director of Marketing and Communications with the Health Sciences Foundation, and today I have with me Dr. Greg Gamble, the Medical Lead for Infection Prevention and Control. Hi, Dr. Gamble.
Hi there, Vita.
So we've heard a lot of talk recently about flattening the curve, and it seems that we may have, in fact, gotten to the peak. It's why we've been staying home and practicing physical distancing, but can you tell us how we might know when we've been successful at flattening the curve? Are there a number of days we need to see no new cases in our region? How is that going to look?
Well, let's sort of tackle that by, first of all, taking a sort of a snapshot of where we are right now and where we've been. So, I mean, if you look at Ontario in general, they've had about 20,000 confirmed positive cases, and they're getting about 400, 500 new cases a day at present. Probably peaked a couple of weeks ago, where they were seeing 600, 700 cases a day. Now, when you go over to the Thunder Bay picture, Thunder Bay District picture, we've had a total of 77 confirmed cases, of which now at this point we're seeing maybe one or two new cases that are detected on a daily basis. And we kind of peaked back, I think it was April 12th or thereabouts, with 9 cases all at once. And so you do get the sense that things are slowing down here. When you look at the incidents, Thunder Bay, you maybe have about 50 cases per 100,000 versus Ontario-wide, you're looking at 160 cases per 100,000. So definitely we're a little bit better than, quite a bit better actually, than the province at large, and we're starting to see cases dwindle down. Now, you're going to want to see no cases popping up on a daily basis for a prolonged period of time, and you're probably looking at least a couple of weeks. And not only that, but what we do here is also got to be done in sort of coordination with the rest of the province. And so I think what we'll probably see is gradual loosening up of the restrictions that are out there, but it's going to be the province that's going to call the shots. The good news is that we're not as afflicted here as the other parts of the province, and so there may be some leeway. It all depends on how the province decides to sort of tackle the relaxation of restrictions.
Great. In terms of an exit strategy from our current situation, how do you think we might start to resume our normal lives again?
Yeah, I don't think we're ever going to be quote unquote normal again, to tell you the truth. It's sad to say, but I think there will be relaxation of some of the restrictions. I mean, basically, people have got to get back to work. People have got to start living their lives. But I think we'll be doing it differently. And so right now you're seeing, for example, things like garden centers opening up, people being able to go out and do landscaping. So, I mean, those areas where people can maintain physical distance and where protocols have been put in place to make it less likely that you'll have spread of infection from person to person. And I think you're going to have to see that unrolled sort of all across the continuum of our lives, and things are going to be dramatically different in that sense. One of the big changes will be, and actually has happened already, is in air travel, for example, where airlines are requiring you to wear masks, and there'll be different screening protocols. And all of these things are sort of being worked on and being rolled out, and once we see that real drop-off in transmission, I think you're going to see this phased recovery be put into place.
Thank you. Some of the questions we've heard about, if someone has had COVID-19, will antibody testing become available to those that think they may have had it and recovered even if they weren't tested for it?
Yeah, they're working on antibody testing right now. There's still a lot of stuff to be worked out. What antibodies are meaningful, how long antibodies persist, even if antibodies confer some sort of immunity. So that's a work in progress. In the perfect world, if antibodies conferred immunity and we knew what antibodies to test for, then I think you'll see that rolled out fairly quickly. but it's still being worked on at the moment.
Okay. Can you recover from COVID-19 and then get it again?
Yeah, that's another area where we don't know yet. Bottom line is we've had cases that have been reported where folks have gone COVID-19 negative and then tested positive on subsequent tests. I mean, small numbers, really more in the line of case reports than large numbers of individuals. And we just haven't had enough of a track record with this virus to really know if, somebody could get it again, just like if with influenza season, where the influenza virus mutates a little bit and then you're susceptible again. We don't know if that's going to be the case with COVID-19. It does mutate a little bit, and so only time will tell.
Okay, thank you. Finally, there's a lot of talk about cloth masks, and certainly with our community starting to relax the restrictions, as you've mentioned, we're getting it into the public setting a little bit more. Can you tell us more about why wearing a cloth mask could be important?
Yeah, I think cloth masks are going to be sort of the new public courtesy that people are going to do. And it's going to be more for protecting others than protecting yourself, although you can always get yourself decked out with a really fancy mask, and it might even be a bit of a fashion statement. but the bottom line is that the reason why you're wearing the mask is to prevent you from expelling little particles into the air that might potentially be infectious to other individuals. And it's going to be of great use where you can't maintain that social distancing. So potentially in stores where, just because of choke points in the stores, wearing a mask might help a little bit in terms of making up for that lack of physical distancing. So that's the key point. You're really doing it for others, and it is a add-on, not necessarily, well, it definitely isn't a substitute for the other measures that we've got in place right now, like physical distancing, like avoiding all sort of unnecessary congregation in sort of large groups in small quarters.
Okay, thank you. So our final question is that there's information floating around that the coronavirus droplets can stay active in the air for 3 hours. And if a person without a PPE mask, not a cloth mask, crosses their path, they might be likely to be affected. Is this true, or what do we know about how long the virus can stay in the air?
Yeah, I mean, there have been studies done and where they try and replicate the conditions of somebody coughing, and then they kind of measure for viral genetic material to see if they can detect it. And they have been able to detect that material in airborne particles for that length of time. They've also detected viral particles that would, you could pick up, a couple of hours, days, maybe afterwards. But the key is what they're measuring. And what they're measuring is they're measuring viral genetic material. And that doesn't tell you anything about whether that virus is actually able to infect you or not. And so I think what you got to do is take a look at what's really going on out there. And if this virus was spread readily by airborne means, then you would be seeing an awful lot more spread, for example, on airlines, on airplanes, before people were wearing masks and precautions were taken. And that just hasn't happened. If you sort of draw parallels between this virus and SARS, I mean, you could also detect SARS, for example, on surfaces by measuring for genetic fingerprints, but you could never culture it. And that's sort of the situation in this case as well. And there's some nice studies actually going on right now in hospitals in Canada, which will really, I think, nail down the fact that this is truly a droplet type spread, and will hopefully make people feel a little bit more reassured. But in the meantime, if you're concerned, wear a mask. And if everybody wears masks out there in public, then we won't have to worry about anything being put up in the air. And there are some very good studies that show that if you put a mask on an individual with coronavirus, the amount of viral material, viral genetic material that you can put up in the air is dramatically reduced by magnitudes. So I think that's probably the way to go. Stop worrying about what's up in the air. Rather, just worry about doing your mask, doing your physical distancing, avoiding getting yourself out there stuck in a crowd in a small space.
And of course, wash your hands and don't touch your face.
And
right?
absolutely, wash your hands and don't touch your face. Those are the basics.
Wonderful. Thank you so much, Dr. Gamble, for your time today.
Great, thank you.
Thank you.